In this module, we will first go over the learning objectives, then move on to the top 10 tips for writing a proposal, and end with an expert video from Catherine Pound, the Resident Research Coordinator for Pediatrics at CHEO. After completing Module 2, Writing a Research Proposal, you will be able to apply the CHEO Research Institute Research Proposal Guidelines to your own work, and you will understand the importance of putting together a well-developed research proposal. A research proposal is an outline for your proposed study. It establishes the need for your research, explains your methods, and presents an overview of your objectives. It also provides the opportunity to organize time and resources beforehand, and to identify potential flaws in the research design. As such, it is critical to the success of your study that your research proposal is well written. The following list will present you with tips to help improve your proposal. Tip number 10, proofread. Spelling and grammatical errors are not only unprofessional, but can also hinder communication. As professionalism and communication are crucial to resident success in both medical training and real-world practice, it is best to proofread carefully and to continually work on your ability to clearly communicate your thoughts and ideas to both insiders and outsiders, experts and non-experts in your field. Tip number 9, collaborate. Mentors and collaborators are key in the development of any research proposal, no matter what stage of your career you are in. You should identify appropriate mentors and collaborators who can, for example, help you with study design, funding opportunities, letters of recommendation, the recruitment of participants, subject area content, study logistics, critical feedback, advice and support, and the list goes on and on. Tip number 8, develop a timeline. The timeline provides you and the reviewers with an overview of the accomplishment of key milestones for the project. It shows the feasibility of your project and will help you get a better idea of your personal schedule during the research process. The timeline should include when and where each major activity in your study will be completed. This is an example of a well put together, although complex, timeline. Tip number 7, write with authority. Writing with an authoritative tone helps you establish yourself as the best possible candidate to complete your proposed work. The simplest and easiest way to do so is to use the active voice. The active voice communicates confidence and certainty, while the passive voice will make you seem tentative and uncertain about your endeavor. Tip number 6, budget reasonably. The point of the budget is to prove that you need the funding and to illustrate how the funding will be used. If it is itemized, it will be easier for the reviewers to follow. If it is justified, the reviewers will see the need for funding and how you will use the money. Tip number 5, use signposts in your writing. Add signposts such as numbering, bullets, and lists to your writing in order to improve readability, identify key points, and increase white space. This is not appropriate. This is not appropriate. And this is appropriate. Tip number 4, clearly state your research problem in the background section. The background and research problem provide an overview of the topic and the importance of it before the introduction of your research questions. This area of the proposal should focus on strengthening your argument for your study, justifying the need for the study, and leading to the conclusion that your research questions and study are worthwhile and will fill a gap, for example, in the literature or address a clinical problem that has yet to be explored by others. Tip number 3, write the abstract last. The abstract is a snapshot of the proposal, summarizing all aspects of the study touched upon in the proposal. As such, it should be the very last thing written. Make sure you follow the guidelines laid out by the granting agency for the abstract. For example, some organizations will require a structured abstract with specific section headings, whereas others will request a non-structured abstract with no section headings. While article abstracts generally follow the format of the article with an introduction, methods, results, and discussion, it is a bit different when the abstract is for a proposal. In this case, the heading should include background, methodology, and future implications, all of the topics covered in the proposal itself. Tip number 2, consider the ethical implications. Any research involving humans will need ethics approval. This holds true whether the study involves patients, families, or staff. Ethical review takes place in order to respect and protect participants as outlined by the 3 core principles of the Tri-Council: respect for persons, concern for welfare, and justice. Approval is required before the commencement of any research, and this point should be made explicit in the grant proposal, both in the methods and in the timeline. This is a snapshot of the CHEO Research Ethics Board website. It contains all the information you need to know and is accessible through the CHEO website under the Research tab. Tip number 1. Sell your research and yourself as a researcher. Reviewers are looking to make an investment in research. Agencies have a limited amount of resources to allocate to research, and whether these resources are time, money, expertise, or equipment, numerous researchers are vying for them. Thus, it is crucial that throughout the entire proposal writing process, you are focused on selling your research and yourself as a researcher. This entails everything from proving that your work is necessary by outlining previous work clearly, to proving that you are fit to lead the project by listing resources required with relative accuracy. Selling does not require a flowery sales pitch, but rather proof that although they receive many submissions, yours should be the one they select.
Hi, my name is Catherine Pound and I'm the Resident Research Coordinator. So now that you've learned about the 10 tips of grant writing, let's spend a little bit of time going over what you need to know to get started. One of the most important thing, if not the most important step in planning your project, is finding an appropriate question. A well-defined question is key for developing the proposal and your final manuscript. The research question is what guides your whole project. When thinking about your research question, you want to keep the following in mind. First, you need to define your population. So who or what are you interested in studying? Then you need to define your intervention. What will you be doing? Will you be collecting data to describe something, to explore a topic, or will you be testing a hypothesis? Then, if applicable, you need to determine your comparison. If, for instance, you're testing a clinical pathway, then you want to be comparing it to a standard of care or something that's already existing. Finally, you need to define what your outcomes will be, or in other words, what you will be measuring. Keep in mind that a good research question has to be feasible, interesting, novel, ethical, and relevant. Don't be afraid to spend a lot of time thinking about your research question, as this is what will define your whole study. Find a topic you're passionate about, so as not to get discouraged when you're faced with obstacles. Think of your personal career goals if you know already what you want to do, and try and find something that already has some scientific background that you can build your proposal on. Keep your eyes open for a question. Whether you're on the wards, in clinic, talking with other healthcare professionals, or even parents, questions are likely to come up in your day-to-day work. Finally, before you start writing, think of other people you might want to involve. As mentioned in the presentation before, collaboration is key. Expert contents, research mentors, statisticians, methodology experts are all people you should think of having on your team before you start writing. So, once you have your question and your team, it's time to start writing. Your research proposal is what you will use to convince the reviewer that your idea is exciting, that it needs to be funded, and that you are the right person to lead the project to completion. Use your proposal to sell your idea and show people why your study is important. Start by stating what your research question is and clearly state what your study objectives are. Put in your hypothesis, what you expect to find out of this study. Then, use the background section to lay the foundation of your proposal. You need to tell your reviewers what it is that's currently known on the topic, because they may not be experts in that area. You need to discuss what's lacking in the literature on the topic and link it to your idea to inform the reviewers of how your study will be addressing the gaps in the literature. This is where you set the stage for your proposal, where you convince your reviewer of the importance of your question. In the methodology part, you want to give enough detail so that whoever is reading the study would potentially be able to reproduce it if they wanted to. You want to state the design of your study. Is this a retrospective study, a cohort study, a randomized trial, or any other type of study design? You need to define your population. Who will be included in your study, and who will be excluded, and why, and how you'll recruit your participants. You then need to describe your study interventions, what exactly you'll be doing with your participants, and your study measurements, what information you'll be collecting. Finally, your outcomes need to be clearly stated. The outcomes are what you will be measuring in the study. In the analysis part, you need to describe how you'll be analyzing your results. This is where getting the help of a statistician or other specific quantitative or qualitative analysis expert becomes important. We have great resources at the Research Institute. Use them and talk to them before you start your study. Get them to help you write this part. Then, you want to write a section on feasibility. How you will recruit the patients you said you would recruit. How will you account for participants dropping out of the study? If you know of a similar type of study with a certain enrollment rate, use that to back up your numbers and convince your reviewer that you're basing yourself on facts rather than speculations. Then you want to have a few lines on trial management. Who will do what in the study? Define everyone's role. What will the principal investigator do? What will the research assistant do, the data management specialist, the statistician? Describe each member of your study team and their qualifications. Make sure you highlight the qualifications that are relevant to your current proposal. Don't forget to put in a part on ethical considerations. You need to ensure that your participants are protected and that their results will remain anonymous. Tell the reviewers what steps you have taken to ensure that your participants' rights to confidentiality are respected. End your proposal by summarizing why your research is relevant and essential. Be sure to include a plan for knowledge translation and dissemination of results. End your proposal by summarizing why your research is relevant and essential. Be sure to include a plan for knowledge translation and dissemination of results. A well-written proposal is the key to a successful project. It's worth putting in the time to make it strong. You'll be much more likely to get funded, and having a clear, detailed plan of what you're doing will help you complete the project with as few hurdles as possible. Finally, the time and effort you put in writing your proposal will be rewarded when you start writing your manuscript, as a lot of the information you put in your proposal will be needed in the final paper. Although this may all sound overwhelming at the start, go through this piece by piece and you'll quickly realize that you have a solid grant proposal in your hands. Don't hesitate to ask for help and use the resources we have available at the Research Institute.
Now that you have completed Module 2, Writing a Research Proposal, you should be able to apply the CHEO Research Institute Research Proposal Guidelines to your own work, and you should understand the importance of putting together a well-developed research proposal. Tip number 10, proofread. Tip number 9, collaborate. Tip number 8, develop a timeline. Tip number 7, write with authority. Tip number 6, budget reasonably. Tip number 5, use signposts in your writing. Tip number 4, clearly state your research problem in the background section. Tip number 3, write the abstract last. Tip number 2, consider the ethical implications. Tip number 1, sell your research and yourself as a researcher. Now that you know the CHEO Research Institute's top 10 tips for writing a research proposal, you are ready to start planning your own picture-perfect research proposal.